As we grow older, one of the most common complaints among seniors is weakness in the legs. Many people describe it as feeling heavy, shaky, or unsteady when they try to walk or stand for long periods. This problem is not only uncomfortable, but also dangerous, because weak legs are directly linked to a higher risk of falls, fractures, and loss of independence. In fact, according to the World Health Organization, falls are the second leading cause of accidental injury deaths worldwide, and seniors with weak legs are at much greater risk. Weakness in the lower body can affect balance, reduce confidence, and lead to a cycle of inactivity where the muscles become even weaker over time. But the good news is that there are many ways to address this problem. With the right combination of exercise, nutrition, medical evaluation, and lifestyle adjustments, older adults can regain strength, stability, and independence. In this video, I will guide you through a complete discussion of what weak legs mean, why they happen, what you should do if you are experiencing this problem, and how to create a practical step-by-step plan to make your legs stronger. We will explore medical causes, daily habits, exercises, nutrition, and when to seek professional help. By the end, you will have a clear roadmap to improve your mobility and reduce your risk of falls. Part 1. Understanding what weak legs really mean. When an older adult says, "My legs feel weak," it can mean many different things. Sometimes, weakness is true muscle weakness, where the muscles cannot generate enough force to support the body. Other times, it may be fatigue, pain, or instability in the joints. In some cases, the nerves are not sending signals properly to the muscles, which leads to a feeling of heaviness or lack of control. One of the most common reasons for leg weakness in seniors is muscle atrophy due to inactivity. When people become less active, their muscles gradually lose size and strength. Studies show that after the age of 50, muscle mass declines at a rate of about 1 to 2% each year if no effort is made to maintain it. This process is called sarcopenia. By the age of 80, some seniors may have lost up to 50% of their muscle mass compared to their younger years. This explains why even simple activities like climbing stairs, standing from a chair, or walking a few blocks can become difficult. Another important factor is balance and coordination. Weak legs are often linked with poor balance, which can be caused by age-related changes in the inner ear, vision problems, or reduced nerve sensitivity in the feet. For example, people with diabetes often develop peripheral neuropathy, a condition where the nerves in the feet are damaged, leading to numbness and instability. This combination of weak muscles and poor sensory feedback makes walking safely much harder. Joint problems also play a role. Arthritis in the knees or hips can cause pain and stiffness, making people avoid movement. Over time, avoiding movement leads to weaker muscles around the joints, which worsens the cycle of weakness and discomfort. In severe cases, weak legs may also be a sign of circulation problems like peripheral artery disease, where blood does not flow well to the muscles. This can cause cramping or fatigue during walking, a condition known as intermittent claudication. Understanding the cause of weak legs is the first step to solving the problem. Sometimes it is a simple issue like inactivity, but other times it may signal a deeper medical problem that needs evaluation. Part 2. Medical evaluation and when to see a doctor. Before starting any exercise or self-care plan, seniors with weak legs should consider getting a medical evaluation. This is especially important if the weakness appeared suddenly, is only on one side of the body, or is accompanied by other symptoms like numbness, tingling, difficulty speaking, dizziness, or chest pain. These could be signs of serious conditions like a stroke, nerve compression, or heart problems, and they require immediate medical attention. During a routine medical evaluation, a doctor may check muscle strength, reflexes, balance, and walking pattern, and they may also order blood tests to check for vitamin deficiencies, anemia, thyroid problems, or other metabolic conditions that can cause weakness. In some cases, imaging tests such as X-rays or MRIs may be used to look at the spine, hips, or knees to detect arthritis, nerve compression, or circulation issues. Medication side effects are another important factor. Many seniors take multiple medications, and some of them, like sedatives, blood pressure drugs, or statins, can cause muscle weakness or fatigue. A doctor can review your medications to see if adjustments are necessary. Once medical causes have been investigated, the next step is to create a personalized plan. This usually includes physical therapy, targeted exercises, nutritional support, and sometimes assistive devices like a cane or walker for safety. The key idea here is not to ignore weak legs or accept them as just a normal part of aging. While aging does reduce muscle mass, weakness can almost always be improved with the right approach. Part 3. Safe exercises to strengthen weak legs. Exercise is the single most powerful tool to fight weak legs in older adults, but it has to be done safely with the right intensity and technique. The good news is that you do not need a gym membership or heavy equipment. Simple movements done consistently can rebuild strength, improve balance, and increase confidence in walking. One of the most effective exercises is the sit-to-stand. This means practicing standing up from a chair without using your arms for support. At first, you may need to push off the armrests, but over time, the goal is to use mostly your leg muscles. This exercise trains the quadriceps, hamstrings, and gluteal muscles, which are essential for standing, walking, and climbing stairs. Aim to practice this movement 10 times in a row, 2 to 3 times a day. Another excellent exercise is heel raises. Hold on to the back of a sturdy chair, rise up on your toes, and slowly lower yourself back down. This strengthens the calves, which play a big role in balance and in pushing off when you walk. You can start with 10 repetitions and gradually increase to 20 or more as you get stronger. Marching in place is also very useful. While holding on to a stable surface, lift one knee at a time as if you are marching. This works the hip flexors and improves coordination. If you feel stable, you can do this without holding on, but safety always comes first. Leg extensions are another option. Sit on a sturdy chair, straighten one leg out in front of you, hold it for a few seconds, then lower it. This strengthens the quadriceps and helps support the knees. Walking itself is one of the most powerful ways to strengthen legs, but it should be adapted to your current ability. Some seniors may only manage a few minutes at first, but consistency is what matters. Over weeks and months, walking distance and speed will improve. Balance exercises are equally important. Try standing on one leg while holding onto a chair. At first, you may only be able to do this for a few seconds, but with practice, your balance will get better. Strong muscles are important, but the brain and nervous system also need training to stay stable. If possible, supervised group exercise programs or physical therapy sessions can be very motivating. Research shows that seniors who exercise in groups are more consistent and less likely to drop out. The important rule is to start slow, be consistent, and progress gradually. Overexertion can lead to injury, so it is better to do a small amount every day than to push too hard once in a while. Part 4. Nutrition and hydration for stronger legs. Weak legs are not only caused by lack of exercise. Nutrition plays a critical role. Muscles need protein to repair and grow, and many seniors do not eat enough protein in their daily diet. Studies suggest that older adults should aim for at least 1 to 1.2 grams of protein per kilogram of body weight each day, unless their doctor has advised otherwise. For a 70-kilogram person, that means around 70 to 85 grams of protein daily. Good sources include lean meats, poultry, fish, eggs, beans, lentils, dairy products, and soy-based foods like tofu. Vitamin D is also essential because it helps the body absorb calcium and supports muscle function. A deficiency in vitamin D can lead to muscle weakness and even increase the risk of falls.
Sunlight exposure for 15 to 30 minutes a day, along with foods like fatty fish, fortified milk, or supplements if recommended by a doctor, can help maintain healthy vitamin D levels. Calcium is critical for bone strength, which supports the muscles and joints. Seniors should include calcium-rich foods like milk, yogurt, cheese, leafy greens, and fortified products in their diet. If calcium intake is too low, bones become fragile, and the legs may feel weaker when supporting body weight. Hydration is another overlooked factor. Dehydration can cause fatigue, muscle cramps, and poor circulation. Many seniors reduce water intake to avoid frequent trips to the bathroom, but this can actually make leg weakness worse. Aim to drink small amounts of water throughout the day rather than large amounts at once. Iron and vitamin B12 are also important because deficiencies can lead to anemia, which causes fatigue and weakness. Foods like lean red meat, fish, poultry, eggs, and fortified cereals can help maintain healthy levels. A balanced diet with enough protein, vitamins, minerals, and hydration provides the building blocks the body needs to repair muscles and maintain strength. Without good nutrition, exercise alone will not give the best results.
Part 5. Lifestyle adjustments and fall prevention. Besides exercise and nutrition, daily lifestyle habits play a huge role in managing weak legs. Many seniors underestimate how small changes in the home and daily routine can make a big difference in preventing falls and supporting leg strength. One of the first things to consider is home safety. Clutter, loose rugs, and poor lighting are some of the most common causes of falls in older adults. Removing tripping hazards, installing grab bars in the bathroom, and ensuring that hallways and staircases are well lit can dramatically reduce the risk of accidents. Non-slip mats and sturdy footwear are also essential. Shoes should fit properly, have non-slip soles, and provide good support. Walking in socks or slippers without grip can increase the risk of slipping. Another key factor is pacing daily activities. Seniors often try to do too much at once, which leads to fatigue and increases the chance of losing balance. It is important to take breaks, sit down when needed, and avoid rushing. Planning tasks so that heavy chores are spread throughout the day rather than done all at once can help conserve energy and protect the legs. Using assistive devices is not a sign of weakness, it is a sign of wisdom. A cane, walker, or walking poles can provide stability, reduce stress on the joints, and give older adults the confidence to move around more. The key is to choose the right device and learn how to use it correctly, often with the help of a physical therapist. Sleep also plays a crucial role. Muscles repair and grow during rest, especially during deep sleep. Seniors who do not sleep well often feel more weak and fatigued. Good sleep hygiene, such as maintaining a consistent bedtime, avoiding caffeine late in the day, and keeping the bedroom dark and quiet, can improve recovery. Managing chronic conditions is equally important. Diseases like diabetes, high blood pressure, and heart disease all affect circulation, nerves, and muscle health. Staying on top of medications, regular doctor visits, and monitoring blood sugar or blood pressure levels can keep these conditions under control and prevent further weakening of the legs. Finally, mental health and confidence play a role. Fear of falling often makes seniors move less, which actually increases weakness. Building confidence through gradual activity, safe practice, and support from family or exercise groups can break this cycle. Part 6. A safe 12-week strengthening plan for seniors. To make all of this practical, let's outline a safe 12-week program designed to gradually improve leg strength, balance, and endurance.
This plan can be adapted to individual ability, and it assumes that the person has already had a medical check to rule out serious problems. Weeks 1 to 4 are for building the foundation. During the first month, the goal is simply to get the body used to movement again. Exercises should be simple, short, and safe. Seniors can start with sit-to-stands from a chair, heel raises, and marching in place. Each exercise can be done for 8 to 10 repetitions, once or twice a day. Walking for 5 minutes, once or twice a day, is also a good start. Nutrition focus should be on increasing protein intake and staying hydrated. Weeks 5 to 8, increasing strength and balance. In the second month, exercises can be progressed. Sit-to-stands can be increased to 12 or 15 repetitions. Heel raises can be done in 2 sets of 15 repetitions. Marching in place can last for 1 full minute at a time. Gentle balance exercises, such as standing on one leg with support, should be practiced daily. Walking time can be increased to 10 or 15 minutes a day, depending on tolerance. This is also a good time to add leg extensions from a chair and light resistance bands, if available. Weeks 9 to 12, building endurance and confidence. In the third month, the goal is to push further while staying safe. Sit-to-stands can be done in 3 sets of 12 repetitions. Heel raises can be done without holding on to a chair if balance has improved. Marching in place can go up to 2 minutes at a time. Balance exercises can be progressed by trying to stand on one leg without holding on, or by practicing walking heel to toe in a straight line. Walking time can increase to 20 or even 30 minutes a day, broken into smaller sessions if necessary. Throughout all 12 weeks, the most important principle is consistency. Progress will not happen overnight, but with steady effort, most seniors notice real improvements in strength, walking ability, and confidence within a few months. This plan should always be adapted to the individual's condition. If pain, dizziness, or unusual symptoms occur, the exercise should stop and medical advice should be sought. But for most seniors, slow and steady progression is safe and very effective.
Part 7. Warning signs and when to seek urgent help. While weak legs in seniors are often due to common issues like inactivity, arthritis, or age-related muscle loss, there are certain warning signs that should never be ignored. Recognizing these red flags early can make the difference between recovery and serious complications. If weakness in the legs comes on suddenly, especially on one side of the body, it could be a sign of a stroke. Strokes often cause sudden weakness, numbness, or paralysis in the face, arm, or leg, along with difficulty speaking or understanding speech. This is a medical emergency, and immediate medical attention is required. Another serious warning sign is severe pain, swelling, or redness in one leg, which could indicate a blood clot, also known as deep vein thrombosis. This condition can be life-threatening if the clot travels to the lungs. Any sudden changes like this should be evaluated by a doctor right away. If weakness is accompanied by numbness, tingling, or loss of control of the bladder or bowels, it could point to nerve compression in the spine, such as spinal stenosis or a slipped disc. These conditions require medical imaging and sometimes urgent treatment to prevent permanent damage. Other concerning symptoms include chest pain, shortness of breath, dizziness, or fainting while walking. These may suggest heart or lung problems that need immediate care. Even in less urgent situations, if weakness is steadily worsening despite regular exercise and good nutrition, it is important to check with a healthcare provider. Sometimes underlying conditions like vitamin deficiencies, thyroid problems, or medication side effects are the cause, and these can often be corrected once identified. The key message is this: do not ignore sudden, severe, or unusual changes. While many cases of weak legs can be improved through safe exercise, nutrition, and lifestyle changes, some require medical attention. Early action always leads to better outcomes. Part 8. Conclusion.
Final thoughts and encouragement. Weak legs in seniors are not simply a sign of aging to be accepted without question. They are a signal from the body that something needs attention. Whether the cause is inactivity, joint problems, poor nutrition, or a medical condition, there are always steps that can be taken to improve strength and mobility. We have covered a lot of ground in this discussion. We began by understanding what weak legs really mean and the many possible causes. We looked at the importance of medical evaluation to rule out serious conditions. We explored practical and safe exercises that can rebuild strength, balance, and confidence. We discussed the role of nutrition and hydration in supporting muscle health. We examined lifestyle adjustments that make daily life safer and prevent falls. We even outlined a step-by-step 12-week plan to gradually build stronger legs. Finally, we reviewed the warning signs that require urgent medical attention. The overall message is one of hope and empowerment. Even if your legs feel weak today, they do not have to stay that way. With consistent effort, proper nutrition, safe movement, and medical guidance when needed, most seniors can regain strength, reduce their risk of falls, and live more independent, confident lives. Remember, progress may be slow at first, but every small improvement counts. Standing up from a chair without using your arms, walking a little farther than you did last week, or practicing balance for a few extra seconds, all of these are victories. Celebrate them and keep building on them. Most importantly, never give up. Age does not mean the end of strength. The human body has an amazing ability to adapt, even in later years. By taking action today, you are investing in a future where you can stay active, independent, and strong. Thank you for joining me on this journey. If you found this guide helpful, share it with others who might benefit. Together, we can spread the message that weak legs do not have to define the later years of life. Strength, mobility, and independence are possible. With the right steps, they are within reach for every senior.